What the foundation does is support Methodist Fremont Health by providing funding for different areas, primarily new technologies, enhancing facilities, as well as supporting program and services within the hospital. In the last few years is the support of the Cancer Center, which has allowed individuals that have been diagnosed and need treatment to be able to do that here in Fremont. It's such a great addition to our community. The programs and services within the hospital, there's over a dozen. Also the scholarships that are given out through the foundation is very important to college graduates. And then truly the benefit to the community and supporting one of the biggest assets in our community is the hospital.
The Fremont Health Foundation is a separate 501c3. It was started back in 1976 by a group of local leaders who really wanted to support growing healthcare, ensuring we had access, ensuring we had technology, and the full, complete set of care right here in our community. Over the time, we've had an incredibly dedicated group of board members who really serve the organization. And in turn, it's a sole support foundation. Every dollar raised stays right here and goes right to the programs and services that we're working to grow and expand and enhance in our community. From time to time, I get asked, why is philanthropy important to healthcare? We make about 8 cents on every dollar. So while healthcare is expensive, what we actually get from a business standpoint might be pretty limited. So take the Linear Accelerator project. For that $2 million that we got through philanthropic support, we would have had to make over $25 million in additional revenue in order to be able to afford that. So philanthropy makes innovation, technology, access to care real in our community. And it's our goal for the people here in Fremont to get the full continuum of care, the latest technology, the best provider, the best experience, and philanthropy really makes that possible.
This recognition means everything to us. It's a credit to the people on the foundation team and to the people at Methodist Fremont Health. They do such good work, and so to be recognized for changing healthcare and innovation in Fremont is super meaningful. The work of the Fremont Health Foundation shows up everywhere in our community because we're serving such a huge area. We estimate that we reach about 70,000 people in the Fremont and Dodge County area. So anybody who walks into the hospital or into one of our clinics is probably being impacted in some way, whether it was an upgrade of technology or a renovation of a facility. We're just changing the community in so many ways, and so it impacts so many people. One of the funds that we have hosted through the foundation is the Caring Coworker Fund, and so through philanthropic support, we're able to support our employees here in Fremont who are maybe facing a crisis financially, and so they're able to apply for funds to help pay bills that would otherwise go unpaid. And so we're able to offer that to our employees to help them stay happy and healthy and be the best employees they can be. The foundation has supported the community with some really big projects like the Cancer Center project. We've done projects in Dunclow Gardens to enhance the lives of the residents there and on our behavioral health unit. We've done some bigger projects, but we also have so many smaller projects that the public likely doesn't know about. We are sometimes able to provide car seats to families who need that to get started and to be able to go home following a new baby. We're able to provide new books to babies that are born here. We provide gas cards to patients who are going through cancer treatment. We often have people who are driving over an hour to get here for their cancer treatment, and so if gas costs are prohibitive to them, we are able to provide support in that way. So one of the things that we're really proud of through the Fremont Health Foundation is being able to offer scholarships to high school students and college students in our area. Most of them are for students who are pursuing healthcare in some fashion, and we've awarded over $400,000 since the inception of that program, and many of the people who have been awarded those scholarships have returned to Fremont to be physicians, therapists, nurses, and so we're really investing in the future of healthcare in Fremont through that program. Being able to purchase a new linear accelerator for our radiation oncology program. Since the purchase of this technology in April, we have 25 additional patients that we're able to serve who would have previously had to drive to Omaha to get their treatment, which is so impactful because they're often doing 25 or 30 days of consecutive treatment, and some of these people are still working and trying to live their life in Fremont, and so eliminating that drive time and allowing them to get their care right here at home is so important. Healthcare is continually changing and adapting to the needs of our community, and so I'm so excited to be able to grow with the foundation and grow with the hospital and see what needs lie in our community next.
Sean's biggest impact was just her commitment to the community, her enthusiasm to work in collaboration with nonprofits, with other organizations, just had a passion for doing great things. I had the privilege of not only working with her with this foundation, but also through United Way when she was there. And she was just so about our community and doing the great things that would help individuals and support organizations. So for me, I've knew her for so many years. She just had a great impact not only on the community, but I would say also on any board member that was able to serve under her leadership. So she is missed.
Certainly it's difficult to sum up what Sean meant to Fremont Health Foundation, to the Fremont community in just a few words. Clearly an incredible impact. What she meant most to us in many ways was really a beacon of hope for people who had challenges, people who needed support and assistance. All of her social services work, her community work she brought with us and really helped us with our focus on the social determinants of health as well. So how can we meet people where they're at? She really educated us. She was a great storyteller. She's somebody who engaged parts of the community who didn't know anything about our foundation in the past. Certainly the hallmark of her time here was her cancer campaign and the work she did. If you've never done fundraising in a community like ours, you don't know how difficult it is to raise $2 million. It doesn't always happen, and without her it wouldn't have happened. And certainly that was a great experience for her, what she would share with us, and then also providing, phenomenal impact to our community. People often, will talk about what's her legacy or what's her impact. Well, certainly you can think of the tactical things, the money she's raised. But I think it's more important, and what we think about most are the lives she changed. Whether those are people that we served here through a cancer program, through scholarships, through our simulation lab, through some of our caring coworker funds, or the way that at certain times she brought our community together. Those are impacts that we still feel every day. So she may not be here with us, but we think of her often and we feel her presence very often in all the work that we do, and feel very committed to carrying on both that legacy and doing that work. So gone, but absolutely not forgotten. Certainly as we look to the future, healthcare is challenging, right? Our crystal ball into what the future looks like is cloudy. There's constant change. It's super dynamic. But one thing I do know is that the philanthropic support, the work of our community, the work of our leaders is paramount to our success. Things may look different and might feel different, but our commitment to delivering the very best care, keeping what we can keep in our community, and delivering for all of those in our region never is going to be lost. The support we get, the investment we make, is not only felt by the people that we serve today in a hospital bed, in a hospice program, in a clinic, but it really impacts the whole community, because when there's better health care for our community, it's a better community. I think there's a very bright future, certainly for us and what we have. I also recognize that in the community, we have to work together. So there is a lot of demand on nonprofits in our community. We only get better as we partner and work together. It's one of the things Sean brought to us. It's one of the things Allie will continue. But the collaborative spirit makes me feel very confident about our future.